Good morning, good afternoon, good evening, everyone, and a warm welcome to our Planetary Health Dialogue on tobacco regulation, protecting lives and environment. Today's event is part of our regular webinar series organized and facilitated by the Center for Planetary Health Policy, a Berlin-based think tank working on the intersection of politics, academia, and practice on the nexus of health and environmental change. My name is Nicole Storff, and I'm a research associate at the Center for Planetary Health Policy. I have the pleasure of moderating this webinar today. And I'm also very honored to be joined by two esteemed guests, Professor Dr. Judith Mackay and Professor Dr. Hendrik Streeck, whom I will introduce to you shortly in more detail. Before we begin, a brief overview of the housekeeping and today's agenda. The webinar will be recorded and will be available on our website in the coming days. All participants, all of you are muted by default to avoid any background noises, but during the discussion in the second half of the webinar, you're invited to ask your questions by using your microphone. Please use your virtual hand to ask a question. Please note that you'll appear on the recording if you do so. The chat is already open, so if you have any questions or comments, please post them there. We aim to make this session interactive and engaging and hope to have enough time to include your inputs and your questions in the discussion. So today's agenda is pretty packed. We'll start with a brief introduction, followed by two short inputs from our guests. And after that, we'll move into a moderated dialogue before we open the discussion. So why are we discussing the regulation of tobacco use, as well as novel products and novel tobacco and nicotine products, such as e-cigarettes and vapes, heated tobacco products, and nicotine pouches? Tobacco and nicotine products are no ordinary commodities. They have a tremendous impact on health. They drive environmental degradation and result in economic losses, among many other harms that they cause. So they are at the heart of the public and planetary health debate. Looking at the health impact, all forms of tobacco use are harmful and there is no safe level of exposure. Tobacco remains one of the leading preventable causes of premature death, long-term disability, and suffering worldwide. The rise of novel products like e-cigarettes and nicotine pouches are thus very concerning. And these often come disguised with appealing designs and harmless flavors, marketed aggressively in digital spaces and on social media, making them especially popular among teenagers, as recent surveys showed. These products don't just expose users to nicotine and other harmful substances, they also serve as gateways to long-term addiction. Beyond the devastating impact on human health, the tobacco industry is also a major driver of environmental degradation. It accelerates deforestation as vast areas of land are cleared for tobacco farming, leading to soil degradation, biodiversity loss, particularly in low and middle income countries. Tobacco production is highly water intensive, and with the tobacco supply chain, it is also contributing substantially to emissions, and it fuels climate change. And very concerning as well, it creates a lot of toxic waste. Cigarette filters alone are among the most littered items in the world, leaching harmful chemicals into our soils and waterways, damaging ecosystems and marine life for decades. Novel products add to this burden as they often contain metals, plastic, electronics, and batteries, creating new environmental challenges across their life cycle. And economically, the costs of tobacco are staggering, from healthcare expenditures for treating tobacco-related diseases to lost productivity due to illness and premature death. So why do we focus on this now? Because it's a real urgency, as just stated, but there's also momentum and windows of opportunity. In Germany, the conversation is very much alive, from public debates to parliamentary discussions, just as last week. And also the resolution at the Conference of Health Ministers, which also took place last week. At the EU level, we are at a critical juncture after the evaluation of the EU tobacco framework. the Tobacco Products Directive and the Tobacco Advertising Directive will be revised. And this will all contribute to the EU ambitious goal of a tobacco-free generation by 2040. So given these complex challenges, but also the momentum and the windows of opportunity, we're very fortunate to have two experts with us today. With that, I'm very excited to introduce Professor Judith Mackay. She is the director of the Asian Consultancy on Tobacco Control based in Hong Kong. She is a special advisor to the Global Center for Good Governance in Tobacco Control and a senior advisor to the World Health Organization. She has more than 4 decades of experience in tobacco control, and I cannot think of anyone more suited to share her insights and experience with us. So Judith, thank you very much for being with us today, and we're looking forward to your input. The floor is yours.
Thank you very much indeed for that really nice introduction, and particularly pleasure to be speaking to Germany. I've visited several times in tobacco control when the late Martina Poch-Galango was with the German Cancer Research Center. And of course, you've got excellent advocates in Germany in the shape of Laura Green, of Sonja van Eichborn, and of course, Habib Benzian, who is one of the original thinkers in public health. So I have quite an association with Germany, and then of course, meet with colleagues at the various COP meetings. But I'm here not so much to comment on Germany, but perhaps just to give an international perspective as to what's happening. And so with my first slide, what I am trying to do, if I could have the first slide up, please. I'm just trying to show the global picture. The next, please. The global picture of smoking prevalence around the world. And you'll see here several things from this picture. This is the global situation of the last data available. It's been put into these graphics. On one side, you can see the share of men who smoke or use tobacco, and on the other side of women. So the first thing that is very obvious is that smoking has been and is, and I think always will be, a predominantly male habit around the world. You'll see that if you add the countries of China and Indonesia and India together, we have half the world's smokers in the region where I'm working. With women, the pattern is quite different. And the big increase of smoking in women that we predicted, Richard Peter at Oxford and I predicted 30 years ago, just hasn't happened. The smoking rates where I live are only 5% and really haven't gone up for several reasons. The other thing to mention about this prevalence is this amazing factor under the heading that adult smoking has gone down by 1/3 in the last 25 years. So I think we can recognize that we have been quite successful at one level in terms of tobacco control in those 25 years, from 27 down to 17%. And that's an amazing achievement in public health. And I think sometimes we just don't recognize when we're in the middle of such hard, laborious work of getting governments to put tobacco onto the agenda and to get things done. And also, I think the other thing to mention is, and we in Hong Kong are an example of that, is that our joint prevalence rates now are 8.5%. We're into single digits. And we have done it without the use of the new tobacco products. We banned them all in Hong Kong some years ago, 2 or 3 years ago. I've had about 40 countries in the world. You do not need e-cigarettes or heated tobacco products in order to bring your prevalence levels down. Next slide, please. The number of deaths from tobacco smoking mimics to a very large extent what I showed in my previous slide. And China can never be forgotten. 1 in every 3 cigarettes in the world is produced in China. The Chinese government, in fact, is the world's biggest cigarette company because it's a state monopoly. 1 in every 3 deaths in the world is in China. China is almost in a class of its own. And I think whatever happens in tobacco control, China has to be recognized as being paramount importance in terms of focusing our global efforts in terms of bringing the numbers down. Next, please. And then, of course, there's the e-cigarette global market that has just hit us in the last 10 to 15 years. Again, the first thing I would say is that e-cigarettes have not only been banned in Hong Kong, they've now been banned in about 40 countries around the world, and another 100 countries have got really quite strong recommendations. We're still seeing two things. The graph shows how exponentially the e-cigarette and vape market are going up, predominantly because young people are taking them up. And secondly, that although they are increasing, we still have got the dark blue of cigarettes being the most used forms of tobacco in the world, and this is not going to go away soon. So I think e-cigarettes are a problem for the public health community, but I would say that there's only 3 countries in the world. England, definitely not Scotland, and with a name like Mackay, you realise why I emphasise that. England, New Zealand and Canada are the 3 countries that have embraced e-cigarettes, and they believe that it's a less harmful form of tobacco and that this is a solution to the tobacco epidemic. I absolutely do not believe that, and I think it will be a very useful thing to debate in the question period. But there's only 3 countries that have really, really embraced e-cigarettes. The rest of the world is struggling to cope with this very new and additional epidemic. Next, please. We have learned many things we've learned over the last 40, 50 years, and that is we have to intervene right throughout the whole cycle of tobacco, with the growing of it, with the child labor, with the pesticides and insecticides, with the poverty that is caused, such as in Malawi, from growing tobacco, the manufacturing of tobacco, looking at the packaging and labeling, the marketing of tobacco, particularly to young people, tax policies, point of purchase, product use, and then, of course, the disposal. So all our interventions with tobacco have got to bear in mind that it is part of a massive cycle of many different aspects. Next, please. We only have to listen to what is called the tobacco industry scream test to know what it is we should be doing. Because if the industry screams, we know that the measure will be effective. And if they don't scream, if they ignore a measure, then we know it's going to be less effective. So what does the industry scream about in terms of opposing the measures with government and with countries? Tobacco tax, smoke-free areas, the ban on tobacco advertising, promotion and sponsorship, the plain packaging and the big graphic warnings, and the bans on new forms of tobacco, to the extent that I think there's not a government today that can start legislating for these 5 areas without getting some quite formidable challenge from the tobacco industry. It's across the board. It's in the huge countries like Indonesia and China. It's in the tiny little islands, which the population would fit into a single building in Hong Kong, but they fight tooth and nail against these areas. So we know contradictorily that these are the things that are going to, our efforts are going to be important. And they more or less ignore traditional school health education, particularly when it's based on telling 10-year-olds that they're going to get cancer when they're 70 or a heart attack when they're 80. And a ban on sales to minors has been pretty much ignored, although this new idea of having a generational ban, nobody after a certain year will ever be able to buy cigarettes. This, in fact, has rather enthused this idea and made it much more viable. But in some senses, our research has done for us by the tobacco industry response itself. Next, please. We have many tools at our disposal, and certainly the most important globally is the WHO Framework Convention on Tobacco Control. Those of you less familiar with this, I would just say that since WHO was formed in the 1940s, they've really had one convention only. Convention like the Maritime Law of the Sea or the Environmental Conventions or CEDAW, the Convention for Women. This is a convention, the Framework Convention on Tobacco Control, utilizing international law for public health. And on this picture, I'm showing not the countries that have signed it and ratified it, but those that haven't, because the vast majority of countries in the world, including Germany, 183 countries, have now ratified this convention. Those in the very dark orange have neither signed it nor ratified it. Those in the light-coloured orange, like the United States, have signed it but not ratified it. This is par for the course for America. America signs but doesn't ratify treaties, even the rights of the child. Signing it means you can go to the meetings, you can't vote, that's actually never voting in these conventions, and you're not supposed to oppose it. So America always plays a sort of side game watching. They don't like supranational jurisdiction. But you can see that the vast majority of the world in grey are now parties to this convention, and it's going up really all the time. Next, please. And this convention basically reads and is complemented by Empower. This basically reads like good public health national policy. You've got to monitor the epidemic. If you don't measure it, you can't manage it. You've got to have smoke-free environment cessation programs and so on. Now, the dark blue at the bottom of this slide are those that have done it like to a gold standard. They've got complete policies. Those up at the top, they've got weak policies or no policies, or data are not available. And you can see here that there's still a good way to go in the world with the number of countries who, I mean, a third of which have really got to be monitoring this epidemic. And again, significant numbers have not done the smoke-free environments, the cessation, the pack warnings, the mass media, the ad bans, or the taxation. But if you think this looks rather disappointing, then you should have seen this 20 years ago. I mean, the number of dark blue are a thin line on the bottom. So there's been an enormous improvement up until 2024 when this was last measured. But it gives you a snapshot of where we are in the world. Next, please. I cannot now give a talk without coming to the tobacco industry. When I first started giving talks on tobacco 40 years ago, they were all on health. When about 10, 15 years later, they started being on what to do, like legislation and education and tax increases. My talks now are all about the tobacco industry, because unless we grasp this political nettle of tobacco control regarding the tobacco industry, then we'll never ever solve this epidemic. And you can see here, this is from the Framework Convention. These are from all the parties voting. What are the constraints and barriers to getting tobacco control done in your country? And you can see here that tobacco industry interference is actually massive. Every country in the world is suffering from this, and countries are struggling as to what to do. By Article 5.3, they're not allowed to engage with the tobacco industry. It's a particular problem for countries like China and Vietnam and the other monopolies where the tobacco industry is part of government. This is, I think, now a major, major challenge in tobacco control. And I would say not just tobacco, it's true of alcohol and the food industry and some of the other unhealthy commodity industries as well. So I think for me, one of the biggest changes in the last 20 years is that countries recognize that they and the governments alone, NGOs, academia can point out what the tobacco industry is doing, publish books like the Tobacco Industry Index, but only governments have got the power and the wherewithal to stop the tobacco industry's behavior. Next, please. This might look a bit sort of grim, this sort of shady character at the school gate kind of thing. But actually, this is a slide from WHO, and WHO is a pretty conservative organization. So to produce a slide like this of the sinister way that the tobacco company is the #1 obstacle for tobacco control, you can see here what they say in addition to advertising and promotion and sponsorship. They maneuver to hijack the political and legislative process. They exaggerate the economic importance of the tobacco industry. 3, they manipulate public opinion to gain the appearance of respectability. 4, they fabricate support through front groups. 5, they discredit proven science and economic evidence. And finally, they intimidate governments with litigation or the threat of litigation or with trade threats. And I think virtually every country in the world now is having to face up to these challenges. Next, please. We have now, every 2 or 3 years, a tobacco industry interference index that is put together by Mary Assunta from Malaysia, but who works from Australia. And this last one had 100 countries reporting. I'm not here as an expert on Germany, but I have just highlighted where Germany stands. Up here are the best countries, Brunei, right down to the worst countries there. So you can see that Germany has got a long way to go in resisting the influence of the tobacco industry, whether it's meeting with them, whether it's the revolving door of some of your senior government people going to work for the tobacco companies. There are many, many, many ways that the government, in fact, is really going to have to address this whole question of the tobacco industry more in the future. Next, please. And this is my last slide. Only governments can stop tobacco industry interference. And without governments tackling the industry, tobacco control is not likely to be successful. And here am I on the roof of where I live in Hong Kong with my Tai Chi sword fighting the tobacco industry. So thank you. That's the end.
Thank you.
I have a final slide just of resources if people would like to follow up on that, of tobacco industry interference.
Thank you so much, Judith, for setting the scene and giving us a snapshot of the global perspective, highlighting the achievements, but also the way to go, that it's still a very uphill battle to reduce tobacco smoking, but also highlighting the challenges arising from e-cigarettes, and the projections until 2030 are quite alarming. So yeah, that gives us a really good overview, and also showing the cycle of tobacco products, and that it's not just one measure, but it needs an array of measures to actually tackle the tobacco products and nicotine products. And also your very clear message on the role of governments, and also the role of governments in counteracting the influence of the tobacco industry. So thank you very much for your clear messages. And we'll continue straight away with our second speaker. And I'm very, very pleased to introduce you to Professor Dr. Streeck. He is the federal government's Drug and Addiction Commissioner of Germany. He coordinates the federal government's drug and addiction policy, makes suggestions, takes up recommendations by the scientific community, represents the government's drug policy vis-à-vis policymakers, the press, and the public. He has been a member of the German Bundestag since March 2025 and is member of the Committee on Health. Professor Dr. Streeck is a specialist in microbiology, virology, infectious diseases, and infectious disease epidemiology, and the director of the Institute for Virology at the University Hospital of Bonn. So with that, we're very happy to have you here. It's such an honor, and we're looking forward to your input on the state of tobacco use in Germany. Thank you so much.
Well, thank you very much for the invitation. I did not bring slides, and I will keep it short. As she just introduced me as a federal government commissioner for drugs and addiction policy, so I'm looking at all different kinds of drugs. But lately, I'm really focused a lot on our tobacco policy in Germany. I'm a medical doctor by training, and so for me, tobacco policy is not a side issue of public health. It is, in fact, one of the clearest tests of whether we are willing to act on evidence, and even when the evidence is uncomfortable. So in one of my latest talks in the plenaries, I said, just imagine a known cause of death in road traffic that killed around 360 people every day. The state would react, the government would react. We would improve technologies, and we would set new rules. And this is how seatbelts, alcohol limits, helmets, and technical inspections became part of modern road safety. And we accept those changes because the purpose was clear. And I think with tobacco, we need kind of have the seatbelt moment. Tobacco, we are dealing with an even larger dimension. In Germany, around 131,000 people die every year. That is around 360 people every day. And behind these numbers, people are having cancers, heart attacks, strokes, COPD, years of illness, years of care, and years of lost life. So that is, in my opinion, tobacco is not a simple question of individual lifestyle, how it's often portrayed. It's one of the largest preventable cause of disease and death in Germany. Germany has made progress in the past on tobacco prevention. For many years, the smoking rates slowly declined. Many people have stopped and many young people did not start. But we have new data that we just presented a couple of weeks ago. The latest data in Germany show, in my opinion, a clear warning sign. Among the 12 to 17-year-olds, smoking increased from 6% in 2021 to 9.6% in 2025. Now, this is a product that is only legal above the age of 18, but we have an increase of 4 or 5% among youth, among 12 to 17-year-olds that shouldn't smoke at all. So we are seeing this reversal in the trend. And what we're also seeing that this is because also the nicotine market has changed. So the entry into nicotine consumption is no longer happens only through cigarettes and tobacco. It happens in Germany through nicotine pouches that are not legal in Germany, e-cigarettes and vapes. And nicotine no longer tastes like tobacco. It tastes now like Coca-Cola, strawberry, kiwi, salted caramel. And the design is no longer looks like an adult product. It looks colorful, playful, digital, youth-oriented, and sometimes stands next to gummy bears and sweets in vending machine. Young people are being introduced a highly addictive substance through sweet flavors, colorful design, and lifestyle marketing on social media. And there's one dimension that I really like to point out here. These products are not even part of the German economy. They are mainly produced in China. At the same time, China itself has placed strict limits on flavored e-cigarettes for its domestic market, largely restricting those kind of flavors. But in Germany, we allow young people and children to get addictive through this kind of market. So as a physician, I also look at the toxicological side of this. Our Federal Institute for Risk Assessment has pointed to health risk of certain flavoring substances and cooling agents used in those e-liquids. Some substances may irritate or damage the lung, can cause cancer, or create new toxic compounds. And this is something, in my opinion, we really have to act on. So currently, I have 4 priorities here in Germany. I know I could have many more, but it's hard to pick the fights there, as Judith McKay has pointed out. But first, in my opinion, we must reduce the appeal of nicotine products to children and adolescents. So flavors such as Coca-Cola, bubblegum, strawberry, that have much lower threshold for use. In my opinion, these need to be banned in Germany. And at very least, substances like with known respiratory risk must be banned because these are substances where we know already they can severely harm the lung. These are certain substances such as sucralose. But in my opinion, I would like to actually ban all flavors except tobacco flavor, as Denmark or the Netherlands have done already. Second, I'm really pushing for an increase on tobacco taxes. Smoking, and my argument here is that smoking causes around 30 billion euros in direct medical costs in Germany every year. 13 billion euros. We are currently missing in our healthcare system 19 billion euros, and we have one cause that causes already 30 billion. In addition, the indirect economic costs are estimated around 67 billion euros. So we have almost 100 billion euros caused by tobacco use. So higher prices, we know from other countries, higher prices reduce initiation, especially among young people. And it is one of the most robust findings in tobacco control. It is, in my opinion, not a fiscal measure. It is, at the end, a prevention of health issues and a prevention of death. But I think that the additional revenue that comes in by tobacco taxation should be put into strengthening prevention, cessation support, enforcement, and treatment. And the bottom line of this is the purpose of this must be to strengthen health and not just the revenue. So the third learning for me is, or the third thing that I'm pushing for is existing rules must be enforced. E-cigarettes do not belong in the hands of minors, and that's a full stop. And if we currently have an enforcement gap among young people by shops, vending machine, online trade, and social media, our law enforcement has to become better to enforce these restrictions that we already have. My fourth point is what we often hear in Germany, that the black mass market is kind of a veto against stronger regulation. I'm not accepting this. So yeah, illegal trade exists and we have to take it seriously, but it must be fought by better market surveillance and by better control. But the existence of illegal behavior cannot become an argument against higher legal standards. So otherwise, every rule breaker gains political power over the law. So the answer to illegal trade is a better enforcement and not to give up. So, and I'm pretty firm on this, that we constantly hear that we have a higher legal market. I don't think this is the right argument we have. I know Germany needs to take its international commitments more seriously, including FCTC, and have more standardized packaging, a stronger ban on point of sale advertising, a strict ban on cinema advertising or sponsorship ban, etc. This, and I know in some parts Germany is doing a good job, in some parts Germany isn't doing a good job. Unfortunately, I'm not in the position to really enforce it, but in some parts of modern tobacco control, Germany is moving, but sometimes it moves too slowly, and that's where we have to be honest about it. But I'm hoping that with the problems we currently have in our healthcare system and the huge financial gap, I hope that Germany realizes that we need a seatbelt moment in tobacco and nicotine policy to not only protect life and health, but also to reduce the huge financial burden caused by the tobacco industry in Germany. Thank you very much.
Thank you very much, Professor Streeck, for your clear words and for also highlighting your four priorities. I think this will be very helpful for the discussion, and there are many points to elaborate on, I think. So thank you very much. And I'd like to actually highlight something that you've said about the restriction of flavors, and also the survey that you mentioned, that the rates of tobacco use or smoking and the use of novel nicotine and tobacco products is increasing among adolescents, which is very concerning, because this is the foundation for lifelong addiction. So what are the measures that you think are most appropriate in reducing uptake by adolescents, and you have the backing from the federal states, as they've just have had a resolution last week on the Conference of Health Ministers, and also pointing out that they want stronger restrictions to protect youth and adolescents. So what's the way forward on this?
Well, I think the best way is to ban flavors, because adolescents are not interested in smoking tobacco, like vapes or e-cigarettes that taste like tobacco. But we currently have a list of 13 compounds that we can easily ban, because the Institute for Risk Assessment, the Federal Institute for Risk Assessment, said that they cause damages to the lung or other organs. this will destroy about 60 flavors, 60% of the flavors on the market. I know they have the ability to readjust them, change the compounds, and have the flavors again. But at least it would reduce it for a moment some of the flavors currently on the market. I think this is the fastest step we can take, because otherwise we have to change the law on tobacco in Germany, and this is a much higher. This is much harder to push through. But already with this 13 compounds, I'm getting a lot of pushback from members of the parliament. So I'm taking the 13 and hoping that I can advance to more products in the future.
Yeah, hopefully that will be a good entry point. And I'd like to bring in Judith, because you have experience on banning novel tobacco products in Hong Kong. You've mentioned more than 40 countries are now enforcing this, but maybe you can elaborate a bit on your experience on how you managed to achieve this in Hong Kong. And also, I've read there was a lot of pushback from the tobacco industry. So maybe you can give us some insights on how you managed to implement this.
Well, one veteran legislator said to me that he had never seen any lobbying to the extent and to the degree that we had in Hong Kong over banning these new products. And he didn't just mean tobacco, he didn't even just mean health, he meant on any subject whatsoever. The tobacco industry descended upon us in Hong Kong. And even our Minister of Health said that they were threatened on an almost daily basis. I mean, she put that in writing. We had a really, really hard time with the industry, but our feeling was here was a new product. The genie wasn't out of the bottle. It wasn't available on the streets. It had unknown and very varied ingredients, as Hendrik has just said. Appalling advertising in countries where it was allowed. The harm aspect, I mean, only now are we still learning about the harm of combustible tobacco. So I think the harm of the e-cigarettes was accumulating, but of course to a lesser degree because it hasn't been on the market for so long. We were quite persuaded by the fact that it was a youth gateway into combustible cigarettes. It didn't seem to us it was offering much help in quitting cigarettes. And I think there was one statistic from the UK that for every one person who quit smoking using e-cigarettes, something like 80 children started using e-cigarettes. And we were really concerned it would renormalize tobacco use. Just as cigarette prevalence was falling, it was becoming sort of quite unacceptable. You just didn't see people smoking very much around. We also noted that previously we'd been twice misled by the industry. One of them, they told us that filters were safe. The second was they told us low tar was safe. This is now the third time in history that the tobacco industry has said we had a safe or safer product. The first two turned out to be untrue, and we really felt that we could not believe what the tobacco industry was saying. And certainly, I mean, I work mostly in low and middle income countries, quite different from Germany, but they're struggling to cope with a combustible tobacco epidemic. And we just felt that, if we were to set an example in the region along with Singapore, these countries couldn't cope with another add-on epidemic. We noticed there was an increasing number of countries banning it. We got our smoking prevalence down into single digits without the use of it. And we were very concerned if we let the genie out of the bottle, how much more difficult it would be trying to ban it, vaping in smoke-free areas or putting warnings on or trying to cope with flavors. I'm sorry to say, I think this is the situation that Germany is in at the moment. We were very lucky in a way that we actually were able to do almost a preemptive strike and to ban it before it became really popular in the country. But I think it was just the absolute opposition of the tobacco industry and its allies was so overwhelming. I think it almost made our legislators feel that they weren't going to be dictated to in this way. They weren't going to be allowed. But One really interesting thing, it was the heated tobacco products that we had the most trouble with. Everybody focuses on e-cigarettes. E-cigarettes will come and go, but the heated tobacco products is apparently where companies like Philip Morris are putting their future. So, I mean, one bit of advice is do not forget the heated tobacco products in any legislation that you might do. So these are why we banned it. And I think we banned manufacture, importation, and sale. And to make it perfectly clear, just last month we banned possession as well in public places. And everybody said, oh, our tourists wouldn't come, that it would be a financial disaster, people wouldn't go out in the evenings, etc., etc., etc. None of which has happened at all since we actually effected this ban.
Thank you very much, Judith. And just for your information, we cannot see you, but that might be because of the weather conditions in Hong Kong. So if you want to check on that, just as a side note. So thanks very much for elaborating.
We're in the middle of a monsoon at the moment, actually. Can you see me now?
Yes, perfect.
Okay, fine. No, we're in the middle of a monsoon, so I'm keeping my fingers crossed that our electricity isn't struck and goes out in the next half hour, as it happened last night. So I'm still with you. Yes, good.
Great, thank you. And with that, I'd like to open the discussion and also involve our participants. And I already see a hand up. So Laura, if you want to go ahead and unmute yourself to ask a question. Please be concise, and so we have some time to also address some other questions. Thank you.
Hello. Hello. Yes, I see also that there are some questions on the chat already that were raised before I raised my hand. Yeah, thank you that I have the opportunity to ask a question. I would like to ask a question to Professor Streeck and also ask Judith McKay to give some international context to this. First of all, thank you very much for your strong public support in this area, Professor Streeck. This is so important for us. I would like to go back to Article 5.3 and tobacco industry interference that was mentioned by Judith McKay. The Article 5.3 means that only those meetings with the tobacco industry can take place that are strictly necessary in the government process. And I saw, unfortunately, that you, Professor Streeck, met with the tobacco industry, with Philip Morris and a tobacco lobby group, BVTE, in December last year. And I see a problem with that because this gives precedent to other government departments that we are trying to lobby that they've put on a firewall. And I would like to ask two questions, actually. Can you clarify the basis of this December meeting that took place? And can you commit to working towards a code of conduct that would prohibit tobacco industry meetings for all departments in government? And to Dr. Mackay, maybe you can give some international context. What would a best practice look like? Thank you.
Thanks, Laura.
Thank you for the question. I think I've been extremely outspoken against tobacco lobby industry, etc. Right? I'm interestingly one of the few who is actually following the FCTC rules and made it transparent of all members of the parliament and made it transparent that I met with them. I mean, you're getting invited every 3 months to huge parties of them, and many of them are going, but I'm not. So I'm the spokesperson of the CDU for tobacco and alcohol as well. And I met once for 1 hour with the whole tobacco industry. I had one coffee and wanted to hear what their stance on things is and what they would actually like to achieve. So that's where I learned that nicotine pouches are for them extremely important to get legal in Germany. I would have not learned that without meeting them. So for me, it was a really, really helpful meeting. Nothing has changed in my opinion towards tobacco industry. And more importantly, I actually have been more vocal after I've against the tobacco industry after I met with them. But I would be very, so I'm a little, would be a little bit wary about using those that are actually following the FCTC protocols on transparency as a bad example how to deal with FCTC. Because I think half of the parliament is meeting with tobacco industry, and rarely anyone is following FCTC. So I already got press questions on this, why I actually met with the tobacco industry for one question, and it's what would be the lessons learned for people that are following FCTC protocols? They would probably not report it anymore. It would have been easy for me not to report it, but I followed FCTC, so I would be a little bit hesitant to point this out as something unfortunate. I think people that are following FCTC, they are following rather the rules than not. So we signed the declaration in Germany, but most people are not following it. I think this is a pity, and I'm not sure how to better engage on this. I keep telling my colleagues that we actually have ratified this, but yeah, that doesn't change the political landscape right now.
Thank you, Professor Streeck. Judith, would you like to respond as well?
The FCTC is, to my knowledge, the only United Nations convention that has anything remotely like Article 5.3 in it. And it basically says that the tobacco industry and its allies and its associates have no place at the table in terms of discussion of policy. They, of course, have to be met with. If you decide you're putting a pack warning on, you have to meet with industry saying, we're putting on, they have to be told what to do in terms of implementation of some of the policies that are decided. The second thing to point out is that the Article 5.3 is not just the civil service, it applies to all three branches of government. It applies to the civil service, it applies to elected members, and it applies to the judiciary. It applies to all three. Now, if we look around the world, I think there's no gold standard on this in any country at all. And particularly the countries with monopolies and the state-owned industries find this extraordinarily difficult. Countries have made a go at it. The Philippines was one of the first to introduce a code of conduct specifically to do with Article 5.3. And there's just a handful of countries that have really followed. But even their protocols only apply to the ministries of health. They're not across the board in all the other ministries of government. So it's there. It's extremely useful. It's extremely useful to point out the way the tobacco industry behave and the duplicity and so on. But as far as governments coming to grips with it, I think Germany is certainly not the only country with a ways to go on this. And I think that it will be developed in the future. I think it's an extremely useful article. It's failed to get through the environmental treaties, as you can see. But I mean, even the delegations going to the COPs and the MOPs and things like that are not supposed to have tobacco industry people on their delegations. It's not just meeting with them, it's quite wide ranging. So I think Germany is clearly struggling with this as to quite how to do it and what to do, but is certainly not alone. I think every country is trying to find their way through this maze about how to deal with them. And they take every opportunity to exploit every crack in this and to meet with, they use COVID, for example, as a massive opportunity to try and make, in fact, a vaccine, in which case they would have sat at the table with WHO. I mean, they're forever trying to infiltrate not just the governments, but WHO, the other UN agencies, certainly governments in every way and shape and form you can. And I think the best antidote to this is not only to keep plugging away that we've got to do better on 5.3, but for example, when we banned all these new products in Hong Kong, we got all the Doctors Association, the Teachers Associations, the Parents Associations, every hospital, every NGO you can think of to support the government. so that the government could see that actually the people didn't want this tobacco industry interference. They wanted to actually ban these new products. Mobilizing public support against this and exposing it, I think, is very valid. I think the naming and shaming of the way that governments do interact with tobacco, and some of them don't even yet know. I was recently in the Middle East, and I said to my colleagues there, you know, what's happening with the tobacco industry in your country? And they had no idea. So I just got out my mobile phone, you know, tobacco industry and the name of the country. They were funding the Queen's Fund. You know, I mean, so some countries are still rather unaware. I think Germany seems to be quite aware of this whole issue about tobacco industry interference. But I think it is emerging as absolutely top of the list in terms of preventing good government action on public health. And economically, I mean, that's the other thing to emphasize when we're talking to government. We need health economists by the bucketful to show just how much tobacco costs countries. Governments tend to see the tax coming in. They just don't look and see the amount of money that they're having to spend. And the truth is, spending a kilobyte on tobacco control now is going to save, you know, a gigabyte of health expenditure in the future. And in that sense, the democracies, I think, have it a bit more difficult than some of the centrally planned economies like China I work with. China has 30-year plans. Vietnam, I met the Minister of Health there just after the war, the American war. And I said to him, you know, your country is devastated by war. Your top cause of death is malaria. This is going back to the 80s. Your top cause of death in malaria, and smoking is quite good at keeping mosquitoes away. I said, I'm really impressed with how much you're actually doing on tobacco control. He said, well, of course, we have to think 30, 40 years into the future for our children. Now, the problem with democracies is that that's much more fractured into electable four-year periods, and long-term planning, I think, is much more difficult in the democracies. But I think that that's why it needs to be institutionalized within government. These principles of how to deal with things must not just be at the whim of different elected governments. It has to be absolutely embedded almost in the constitution with a small c of a country.
Thank you very much, Judith, also for pointing out the long-term perspective in this, and yeah, that it might be fragmented or more difficult to do it in democracies, but we do have a very open debate on this in Germany, and I think it's very important to include all the different parts of society, and I think they also have a strong voice. So thanks for pointing out that as well. And I want to include some questions from the chat that link quite well. So there was a question on tobacco taxation, and because Professor Streeck said that you mentioned that you are pushing for stronger taxation for tobacco. So the question was, how are you doing this, and do you have lessons learned? And maybe also in connection with that, the arguments for stronger tobacco regulation is enormous. We've discussed the health benefits, the economic benefits, but also the environmental benefits. So the question is, from a public health and planetary health perspective, why are we so hesitant to be stricter with tobacco industry and tobacco products? Professor Streeck, maybe you'll start.
Well, so I'm currently trying to use the gap we have in finances in the health system to use as an argument that we have to have higher tobacco taxation. The argument, because I saw that also on the list, the argument against this is that we would have maybe a loss of revenue, where I said loss of revenue because people will stop smoking. There I basically said that no state should build its fiscal stability on people smoking, becoming ill, and dying prematurely. But this is basically one of the strongest argument against higher taxation. So Germany agreed to have a moderate increase, consistent moderate increase in taxation. I would like to have a push in higher taxes immediately, that more people are stopping and more younger people and adolescents are not even starting to smoke. I'm hoping that this gap, what we have in the health system, will really help to increase taxes here and also on alcohol. But I'm not sure whether we are able to get through to this. Like from the health politicians, we are basically all on the same side that we would like to have an increase in taxes. When we talk to our colleagues in agriculture and nutrition, they are very much against it. And the financial colleagues are also against an increase in taxes. So we will have to see what we can achieve within the next weeks. And it will be decided probably within the next 2 weeks.
I think just to come in here, I think one of the hot topics that really is in the international tobacco control community at the moment that came up at the last COP in Geneva a couple of months ago is on Article 19. Now, Article 19 is on liability. And liability, some countries have been trying to sue the tobacco industry for decades, like Canada, to sue them for healthcare costs to raise funds for tobacco control. And for most countries, it's really difficult. It's expensive, it's lengthy. It goes on for decades because the tobacco industry take it to the next level and so on. But what the COP was looking at is, are there alternative measures other than taxation to actually bring the tobacco industry into account and to make the polluter pays principle work? And I'll just give 2 examples here. What Canada has just done with a cross-party agreement and with the agreement of the people in Canada is to put a levy, not a tax, a levy on cigarettes, and they are using that to fund all their government tobacco control work, whether it be getting laws through or health promotion. It's not a compensation fund for smokers. It's a government is saying we're spending this on tobacco control, and it is actually already in progress. It's making the tobacco industry pay, and they do not call it a tax, they call it a levy, and apparently that's much easier to get through. And the second one is that the city of Baltimore is actually doing almost the same thing with the tobacco industry, but in terms of waste and cleanup and all the rubbish and the paraphernalia and the cigarette ends and the butts and the matches, the cost of actually the environmental costs of tobacco. The city of Baltimore is in the process of actually leading the way with the case to just, again, put a kind of levy, a cost on the tobacco industry without having to go through the courts, without having to go almost through many government sort of processes and taxation. But there are other ways, and I think this is going to be discussed much more at the next COP. And I think this is really interesting because it makes it possible for countries that don't have the lawyers, they don't have the systems to actually take on big tobacco in court. It makes it possible. I think these principles that are all coming up, there's a lot of excitement in these ideas. Never mind the idea of a compensation fund like there is with AIDS, for example, in the world. I think there is an active looking at how can we make the tobacco industry pay without being ground down for decades in court with them. I think this is really quite exciting.
Well, at Tobacco Levy, we put forward also for this discussion on the health finances, but that was not accepted by the Ministry of Finances.
Then we need the health economists to persuade them, because ministers of finance, and they, of course, are the important ministries, they're the rich ones in most countries. They have the nicest building, they have the biggest prestige, much more so than ministries of health. We need health economists to put all our arguments into health economic words. And, you know, the World Bank, the Asian Development Bank, Davos and places like that, every one of them has said that tobacco is a debit to the economy. And yet we have to focus much more on that to persuade the stronger departments in government, like ministries of finance, to actually accept that it's not health or wealth. It's actually health and wealth together. I mean, it sounds quite trite to say it like that, but it's absolutely true. And there's just been studies published in China showing that, yes, they get a whack of tax coming in from tobacco, but They are spending half as much again, and we're talking trillions here. They spend half as much again on healthcare and other problems caused by tobacco. It's that economic message that I think tends to persuade governments, whether they are democratic or they've got kings or whether they're centrally planned economies. This economic argument, I think, is very much in our favor. And I think we need to develop more as a strength.
Yes, thank you very much, Judith. And also, as Professor Streeck pointed out, there are many reforms going on in the German healthcare system at the moment. So this is a very valid argument to the economic costs that come from the consequences of tobacco use. As we are approaching the end of this webinar, I'd like to give another opportunity for your final words. Sorry for all the questions that we could not address now, but being sensible of your time, I'd like to give Professor Streeck and Judith the last words.
Well, I fully realize that Germany is in some parts of tobacco control and well, in particular in terms of health, not doing a good job right now. But I also realize though that it's not easy just to change something from one day to the other. So I would like, of course, to push on some areas much harder and much quicker, and also have better regulation, for example, on products like nicotine pouches we didn't talk about at all. But I cannot make those changes alone, and those changes are only achieved within the parliament if I get a majority. And it's for some of those issues, it's hard to get a majority, especially among those that are at the end deciding. So it's a good time right now to be loud and ask in Germany for higher taxes and for higher tobacco control, because in the next 2 weeks this is going to be decided. So whoever can be loud, write emails, and I don't know, be active, please do. Thank you.
Thank you very much for your honesty as well, addressing all the barriers and the pushback from your colleagues, and also for the call to action to everyone to be loud and to support stronger regulations. And so that's very valuable. Thank you, Professor Streeck. Judith, would you like to have some concluding remarks?
Well, I think Germany is pretty lucky to have Hendrik in the position that he's in. I mean, I've met so many ministers and from so many different departments, of course, particularly health and parliamentarians. And, you know, to have somebody who's basically on your side and trying to do what you want to do as well, I think is just remarkable. So I think, you know, you've got a head start in trying to get things done. But there's no quick fix to this epidemic. I've been at it full time now since I left hospital medicine in 1984. And I mean, I keep saying I'm going to be working till I'm 100. And some people have said, why stop then? So I think this is obviously going to be it's a long haul. The lessons we've learned are that it requires determination, it requires a long haul. We've also learned how tobacco control worldwide is so similar. It's the same product, it's the same harm, it's the same obstacles, same tobacco companies, the same solutions. I've recently worked quite a lot in the Middle East, and I mean 90% of the work that I do is identical. So every country is sort of facing this, and there is strength in numbers. And I think, you know, the meetings of the FCTC, the COPs every 2 years, is quite empowering. We've got those roadmaps of Empower and the FCTC, but I think again I must come back. And we've got some new ideas like the generation ban, tobacco-free portfolios, how to make the tobacco industry pay. We need some new ideas to inject into this as well. And we have had that success that I mentioned right at the beginning of the slides of reducing smoking by 1/3 by all the things we've done. I mean, that is some achievement considering how entrenched basically tobacco was. But I have to end with the tobacco industry. I mean, unless we really face them up and tackle them. Only governments can do this. And this is what really, I think, the next 20, 30 years is going to be more and more. The health data are all accepted now. It kills. It kills up to 3/4 of people who use combustible tobacco. You know, there's no other consumer product on the market even remotely like it in terms of its lethal effect. We accept that. And we know what we need to do in terms of tax and laws and things. That is not easy. But unless we actually tackle the tobacco industry, we're just not going to be successful. So I end on a note of optimism and pessimism, both.
Thanks again for both of your inputs and your time, and also facing the discussion and questions from the audience. So this is very much appreciated, and also your clear messages and your commitment to reduce the harm caused by tobacco products and also novel tobacco and nicotine products. So thank you very much for your time. And with that, I'd like to conclude this webinar today, and also let you know that we are going now into a summer break with the Planetary Health Dialogues, and we will continue again in September. So please look out for any updates on LinkedIn and our website. But there is some reading if you like to go further into the impact of tobacco, but also alcohol, big tech, and mobility, for example. So there's a think piece. The link is in the chat. It's on the commercial determinants of planetary health. And I'd also like to point you towards another webinar series on environmental chemicals. So one session is actually taking place tonight. It's on environmental chemicals in food from 6:30 to 8, and another one is coming up on 8th of July, and that's on the environmental chemicals in contact with the skin. So the links to register for those events are in the chat. And with that, I'd like to thank everyone a lot for your time, for your commitment, for your passion to reduce the harms of tobacco and nicotine products. And I hope to continue the discussion in other forums. So thank you very much and have a good day.